document to Mindy?
Yeah, I think, whoops, you've disappeared on me. I think we're gonna all submit it individually as a committee, the subcommittee groups to the committee, and then I think just for right to know purposes, then it has to get dispersed
Correct.
that way.
Oh, okay, okay. I wasn't aware what process we needed to use.
Yeah, I'm always confused, but try to be
That's right.
cautious because I don't want to do it
Yep.
wrong.
No, I understand.
Good morning.
Good morning.
Morning, Mindy.
Sorry, I'm a little late. Some technical difficulties with my computer.
Morning.
Good morning. Alan, can you shoot me the statement that we have to read?
No problem.
Thank you.
Morning, Mindy. This is Ava. How are you?
Hi, Ava. Good. How are you?
I'm well, thanks. So in the chat, I did put as a reference for you the roster. So once you are finished reading the right to know, that'll be right there for you to call the roll.
Can you post it again? Because I don't see it.
Oh, yeah. It might not appear to you.
Right.
And Mindy, I just sent that over to you.
Great. Thank you, Alan. Alan, oh, we can talk about this after. Never mind. Okay, I'm going to read the statement that we have to read to get started today. Welcome. I am Mindy Mesmer. Today we will be conducting a remote meeting of the Health Subcommittee of the Commission on the Environmental and Public Health Impacts of Perfluorinated Chemicals. Before we get started, I'll read through a checklist to ensure that the meeting that we are holding is in compliance with the right to know law. I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic and in accordance with the governor's emergency order number 12, pursuant to executive order 2020-04 and its extensions, this public body is authorized to meet electronically. Please note that there's no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to the governor's emergency order. In accordance with the emergency order, I'm confirming that 1, we are providing public access to the meeting by telephone with additional access possible by video and other electronic means. We are utilizing Zoom for this electronic meeting. All members of the committee and selected legislative staff have the ability to communicate contemporaneously in this meeting through this platform. And the public has access to contemporaneously watch and listen to the meeting on Zoom, YouTube, and via phone by following the directions and links provided on the General Court website. Number 2, we have provided public notice of the necessary information for accessing the meeting in the Senate calendar. And number 3, we are providing a mechanism for the public to alert the body during the meeting if there are problems with access. I'll go back to number 2. It was also posted in the House calendar for access to this meeting in case you're looking for it. If anyone has a problem, please email us the remote Senate ledge.state.nh.us or call 603-271-3043. In the event the public is unable to access the meeting, we will adjourn and reschedule. Please note that all votes taken during this meeting will be done via roll call vote. Finally, let's start the meeting by taking a roll call attendance. When each member states their presence, please state where they are and if anyone else is in the room with you during the meeting, which is required under the right to know law. I'm going to call the roll now. Representative Wendy Thomas.
Yes, I am here and I am alone in Merrimack.
Representative Gary Woods.
Yes, I'm here in Bow in my study by myself.
Representative Nancy Murphy.
Yep, home in Merrimack, some other children in the house, but alone in the room.
Nancy Harrington.
I am in Merrimack, New Hampshire. I'm alone in the room.
Katie Bush.
I'm here in my office in Concord, and I share a cubicle with one staff person who's here on the far side.
Amy Costello. I don't see her this morning. Rebecca DeVries. Okay, and I'm Mindy Mesmer. I'm here in my office in Rye, New Hampshire, and I'm alone. All right, let's get started. We're meeting today to prepare our sections of the Health Subcommittee report for presentation during a public meeting on Friday, October 2nd at 9 a.m. And I apologize, I appreciate everyone's efforts. This is a little bit difficult than we are normally used to trying to conduct this type of business via Zoom. However, it is really important for us to continue to do this kind of work in the public realm so that the public feels that their concerns are being heard and addressed. So in that vein, Mr. Rapp, I'm going to put together our sections and work as a subcommittee on those sections. And then after we are done with the sections as we see fit, we will take input if there is any from the public who we can't see. This is an odd situation that we're in here with the Zoom, but we can see each other, the panelists who are part of the subcommittee, but we can't see if there are members of the public. So I just want the public to know that we can hear you when you're addressed and allowed to address the committee, but we can't see you. But we do think that your input is important. So I'm going to ask that you reserve your comments until we have completed what we feel is a draft recommendation to the larger commission to be presented on Friday. But we will hear your comments and address them during this meeting as panelists. So to get started, we had an agenda put together for what in the last meeting for the submission that we're preparing today. And so I'm going to go through those sections and ask that each of the people who are working on those subsections to send them to me right now via email so I can post them as we work on them right now. So the first section is summary of meetings findings. Representative Murphy and Nancy Harrington were working on that section. I'm going to try and share my screen now. So could one of you or both of you please send that via email to me if you have it. Otherwise, we'll work on it here together. Can everybody see the agenda?
Yes.
Okay, great. Thank you. I will. Are you guys going to send it to me?
Nancy, you sending it?
Trying.
I know this is this is challenging, but it's so much easier when we're in person and we can work on paper, but this is fine. We'll do it. It's so important to do this and to make this.
We're just getting a taste of what the kids go through at school.
Yeah. But it is really important that we continue to maintain a transparent process here.
Yeah.
If it takes you a few minutes, Nancy, I can go on to the next session and come back to yours.
Sure.
Okay, great. The next section is one that I drafted up a proposal with some input from Ms. Bush this morning and sent that, let's see, this is completed tasks. So here's the proposed section started. Can you guys see that?
Yes.
Got it. Okay. So just a really, I'm making all of these very terse and short to the point, not a lot of external, extraneous language. So this first section, so that it's completed tasks. And I took the information provided by Katie Bush on the grant, the Apple Tree grant that was awarded to NHDES and DHHS, and put that language directly into the report. There were some additional, so if everybody wants to check this out quickly, I'll leave it here. There were some additional questions that we had asked ATSDR, whether they could form a community assistance panel, whether they can connect with the New Hampshire Medical Society to provide updates to the Medical Society on health information. And I've also pasted in the responses that we received from ATSDR. So this isn't really completed tasks though. So these items that are not completed yet should be clipped into the other section, I think. So once we get to that section, so for instance, the public documents, the public water supply system and the private well consultations are not completed yet. Is that true, Katie? So those should not be in this section under completed tasks. We'll put them in the other section. The CAP, we got the answer that they're not planning to start a CAP, but I think one of our recommendations then may be, if this subcommittee wishes to do so, that we push that a little bit further and ask for a CAP formally. If that, I think that is something that the public and the representatives present here really wanted. So if that's the case, I would recommend that we put that into the recommendation section. Okay, I'm going to move on, assuming that if no one objects, I'm going to assume that's agreement.
Agreed.
Mindy, this is Katie. Can I just
Sure.
make one suggestion sort of in terms of flow?
Yep.
Because I do think that like the task was to check with ATSDR about, where things stood with the report, or I feel like that.
Right.
And so in this section, could we have a next step under each item, like either a next step or recommendation? Or do you think that it should, just to help with the flow, or should it really, like the whole bulk should then move to a new section? Just wonder, trying to think through how someone else would read this document. So like we said, we would do these things, we checked, here's the update. Our next step is this, or we checked and this is the update and our recommendation is this. And then the recommendations at the end could be like a summary of all the other recommendations.
Yeah.
I don't know, I'm just trying to think, sorry,
Right.
I just was trying to think through where things should go really, and
Right. So is
have
the
some
completion-
input, and I'm wondering what section it should go in.
Yeah. So I don't remember. I haven't done one of these commission reports in a couple of years, but myself, and I'm trying to remember. There's a certain structure to these. But I think we can say that if people want us to, we can say the task was completed insofar as we asked for this, but and then cover it then in a recommendation section also. Just
Excuse
worried. Yep.
So in the uncompleted task section, I cover this public water system and private well consultation study. And I also cover the one at the bottom, which is the hospital, the group of getting the 4 local hospitals together.
Okay.
So I'm not sure why it's here when it was in. So we either have to take it out of my report, which leaves my report nothing because I only had 2 talking points, or keep it here. We have to take it out of one place.
And your section was, let me just get back to that again. Your section was
Uncompleted tasks.
uncompleted tasks. Okay. Yes, I agree then that should be in the uncompleted tasks section. Unless someone else disagrees with that, I'm going to say that. Why don't we then go to, can you send me the
I did
section
this
you wrote?
morning. I sent to everybody my draft this morning.
Yes.
It was a reply to, I think, Ava's email or one of theirs. Let me see. I can, let me see
Please
if I
forward
can-
it. I don't see it. But oh yes, now I see it.
Okay,
Um,
very short, very short. And I didn't use quite the language that you used under this section, so we might want to merge the two. So that's it, yeah.
okay, so here's the working document. We're putting this in completed tasks.
So the way I interpreted this is I put in reasons why we want to get this information, why we want to do this task. So, but do you see what I'm saying about how it's redundant with the previous one?
Oh yeah, no,
Okay.
it's
All right.
yeah, this is part of the working document that we have to, and it's the way that we have to do it in public. Okay. So let's see, receive public health and private. The effort is in progress. Okay, according to ATSDR. Yeah, we should put a little bit, maybe we can pick out, let's see. From down here, there was, okay, what if we pick out, I should probably pull this information in and make it fit in there somehow.
Yeah, that's what I was thinking. I mean, we can just merge the two. So you can get rid of that next sentence. And I wasn't completely sure, but I assume that its PFAS chemical amounts along with other identified contaminants will be in that study. I haven't seen a list of what they're specifically looking for, whether it's PFAS alone or, but anyway, that's,
Katie, do you have any input into that?
No, I don't. I think when as this gets drafted, it's certainly something we can share back with ATSDR.
Mm-hmm. Yep.
I mean, I would assume they would be looking for things like arsenic and other common contaminants. And then the final paragraph in that section about, that was just my interpretation. No. Go up.
Yeah, no, I know I'm gonna pull this right here,
Okay.
just like we did before. We'll meld it together. Okay, go ahead, sorry.
No, the second paragraph in under item 1, that was just my interpretation of why it's important to get this information. I'm not sure that that's absolutely needed. I think it's good to know why we're waiting for it and what we're going to do with it. But oh, I guess it's gone.
I put it right here.
Yeah. So yeah, I just think it tells why we're waiting for the information. And then, and
Yep.
anyone can object to this. I mean, this is just a draft.
Right.
And then the second one, yeah, explaining again that it's a work in progress. It's going to take some organization to get the hospitals to work together, but the information coming out of it would be very, very beneficial.
I'm not sure why that's, I'll fix the formatting later.
I think it's a recommendation.
Right, but we asked about it and it's not completed. So do we can put it in our recommendations. I think it is in our recommendations too, actually, but we'll check and make sure. I'm going to actually put a note there.
All right, so those were the only two items that were on my list.
Okay. All right, so I'll, let's see. This is an effort that we would like to see happen and take on the hospital's coordinated with HDSDR. Okay, and so this is the answer about it.
Well, and that's the justification for why we're continuing to list this as an ongoing effort, because the information we could get from it.
This actually goes to a different section, which
So-
we,
Wait a minute, what's that part about Ps? Because are we including Ps, or is this Merrimack specific, or is this New Hampshire?
well, they're saying that they're doing some clinician outreach as part of the P's study. So some of the physicians in the state, they're just answering broadly that they are doing that for P's. But one of our recommendations should include specific clinician outreach to
I got it.
physicians in the Merrimack area too. So I'm going to put a note here that we address this as later in our recommendations section as well.
Okay, and then that's it for uncompleted tasks.
Okay, and then this likewise, this goes into a different section, which I'll pull later. Actually, it's already in there, so just going to highlight it. Okay, so we have uncompleted tasks, completed tasks. And let's see,
Can I just make the suggestion that completed tasks come before uncompleted? Just
sure.
Good news before the bad news, sort of?
I don't have Nancy's section yet, but
Okay.
at
Sent
least
it.
I don't think I do. Okay, I'll check again.
Okay.
I'm
I'll
having some
try.
issues with my computers today for some reason. Okay, so completed tasks. What happened to the? Oh, here. Wait a second. This is part of uncompleted. Yeah, sorry.
You will not hear any complaints from any of us, because I certainly would not be able to do what you're doing.
Ah, good. I'm trying to do it as fast as I can, but you know, it's not. All right, so we did uncompleted tasks pretty well. Is everybody okay with this format? We may have another item or two to add as we go through this, but I think this is a good attempt at a first draft. Let me just see if I got that. Yeah, yes, I did. Okay. So this will be, what was the section called that you?
That was uncompleted tasks.
Yeah, no, I'm looking for this one right here.
Oh.
This is what we kind of laid out that we were going to do in this section. Not one section. Recommendations. That's where I put it. No. Where did I have it? Sorry, guys. Okay. This is going to become our draft, so I'm going to rename this. Okay. This is what we were going to have. Oops, did I put the, sorry guys. Okay, so I'm going to clip in what I just received from Nancy. So I don't know if the blood testing thing has been covered yet. Oh, yeah, it was. Okay, you guys covered it. Let me just put these section outlines right down here again. Okay, so we did this. Serum blood testing is in there. Summary of meetings. Did you guys put that in there?
Yes, we did a cursory. We didn't go into, and we didn't know whether we should summarize each meeting. We just summarized how many we had and what was covered and what was yet to be covered.
Okay. Usually what we do is we just put the meeting minutes into an appendix of these reports. So if we just, I know that we'll just summarize, we'll just do that. We'll just probably add.
At the very first sentence, you'll say there have been 5. There have been 5 meetings to address the 3 stated responsibilities. And then we listed who we received testimony from. So that's probably where you're talking about meeting notes, right?
Yeah. So this should go into, some of this should go into uncompleted tasks or recommendations too.
Or probably that whole paragraph.
I have one sort of clarifying question since I haven't been part of some of the previous conversations. But talking with John Alley, the toxicologist at New Hampshire DES, there was just some clarifying questions around vaccine efficacy. And I guess I don't know a lot about that, but that's a term that has a lot of different potential interpretations. And so do we really mean their response to vaccines? We may just want to clarify, I think, because I think that term can mean different things. And just to be sure that we're all really, I think, talking about sort of immune response to vaccinations or the success of vaccinations. See, even in trying to think this through, there it could mean lots of things. So what we mean there, I think, is important.
So,
and I'm not as familiar with the work at Silent Spring, so that's certainly something I can go do some work research on my own.
So the agency ATSDR lists on their website, which we'll get into under, this is the recommendations section, which I'll pull in a second. They frame it as decreased vaccine response. This is, you know, I know this is, I'm going to just change it to just match that terminology because that's what the ATSDR's website says. Is that appropriate?
Yeah, good idea.
Okay, just so we eliminate that.
And did you suggest putting that under uncompleted tasks? Because that's not something we're doing. This is
No, I wasn't talking about this. I was talking about
okay. All right.
some of this stuff, the blood testing is what I was referring to.
Okay.
I was just thinking it was not complete because Silent Spring hadn't come to do that yet. So in that sense, it was not necessarily our work, but to hear from them on that.
So they haven't been scheduled. So that's the uncompleted task.
Yeah. Yes. Yeah.
Okay.
Yeah.
Okay, so let's put that in there because we did a presentation. COVID is in there. Okay, just checking to see that we, okay, so this letter dated, so there has to be.
Probably copies of those letters should be an addendum as well.
Yeah.
Do we yet have the response letter? I know the letter we sent in March requesting that the blood samples be maintained, requested from us an explanation of the rationale for why and the length of time that we were asking the specimens to be held. And I know that somebody was going to draft that. I'm not sure if that has yet been drafted and sent, but that would also, I would think, should be included within this part of the report.
Say that again. So you mean a response letter that we will draft to the
Yes.
DHHS?
Yeah, I think we
Yeah.
talked in our last committee meeting about we had sent the March 6th letter requesting that the blood samples be maintained. And I believe a September 3rd letter from DHHS came back saying, requesting the rationale and the expectation for length of time that the blood samples would be maintained. And I think we discussed at our last meeting, somebody was going to put together a draft with a brief explanation of that rationale to be approved. I thought maybe tomorrow at our next
On
meeting.
Friday.
Yeah, and then sent. So I just think that should be included in this too, just to sort of close the loop.
Can I ask a quick question about the next meeting? So you guys have mentioned that a couple times. I don't seem to have a calendar invite or notification for a Friday meeting. I saw the email that all of the materials are required by Thursday, but the next calendar invite I have for the commission is not until October 30th.
You guys will get, hold on one second. Let me see here if I've sent them out yet. Hold on.
And it's 10 o'clock, right?
I thought it was 9, but
I think
let
it's
me see.
9.
The communications subcommittee on the 2nd is at 10 a.m.
Oh, so it's not
just
us.
communications. It's not a
Yes.
full team.
Correct.
Got it. Okay.
Okay, but the communications team is going to put together all the pieces. Aha. Thank you.
Sorry about that.
And I will note, this is Ava, I'm sorry to interrupt. So yes, the communications subcommittee is meeting on Friday at 10. However, I believe I mentioned in the email I sent out yesterday, or actually it was over the weekend, that any submissions from the other subcommittees, so health, environment, and policy, need to be submitted to me and Representative Rung to provide Senator Deach and the communications subcommittee with by 9 a.m. on Thursday.
Right. That's why we're
Okay.
doing this.
Just to
Yep, that's why she's
clarify-
hurrying.
Just to clarify, I've heard 2 starting times for this meeting, 9 and 10.
It's at 10. I'm sorry.
Thank
So
you.
I will confirm it is 10 a.m. on Friday is the communications subcommittee meeting. The
Thank you.
deadline to submit any subcommittee submissions is 9 a.m. on Thursday.
So do the chairs of the environment and health subcommittee meeting have to be there to present this, or how's that going to happen with respect to right to know? How do you want us to communicate this so that we comply with right to know?
Well, I mean, I will have to follow up with Senator Deach on that, but the goal was for all subcommittees to provide their submissions on the pertinent information they want in the interim report to myself and Representative Rung as the clerk to the entire commission by Thursday. So, I mean, that information can be public once the communication subcommittee discusses it. I mean, I can follow up with Senator Deach on that, but.
Yeah, could you please, because I think my interpretation is that any communication representing a quorum, we have to be really careful about how we communicate.
Yep.
If you're just sending information to the rest of the committee or subcommittee or to a subcommittee from work you guys have done, that does not constitute a quorum, and it's okay as far as communication goes. If you were meeting to actually vote on things, make decisions as a commission, study committee, subcommittee, then you would have the right to know, be okay. But as far as sending things over to Ava and Senator Deach, that's okay.
Okay. Got it. Thank you.
Thank you, Alan.
Sometimes that law degree comes in handy.
Recommendations, proposed legislation. Okay, so I did draft up, we're gonna have to go back and forth between just trying to make all of these so that we'll just kind of skim through all these first, because they're all kind of related and complicated if we don't do it all together. So we at least have sort of a framework of how we're going to do this. So this is the last section. Okay. So here, so far we have a summary section, which needs a little work still. Or at least we have to make sure that some of these, I agree with Nancy that this response should be included. And I don't recall who, but I don't think we're going to have the time to draft that response unless someone wants to take it on before. I think we need to just say that our future work will include drafting this response. Because I don't, unless someone wants to take it on, I don't think we have time to do it. I don't have time to do it. So is there anybody that wants to take that on, drafting a response before before Thursday? Nancy?
Yes, I'll do it.
Representative Nancy, okay, cool. So yeah, so we will then say, something like this. So when's our next full commission meeting then?
I believe October 30th at 10 a.m.
That's
Just before,
correct.
right, it's like the date, it'll be a chance to review, I think, the draft before it's due the next week.
Okay, so I'll just say that. So this kind of then has to be uncompleted task, right? So I'm
Yes.
going to. That's right. That's what you were saying, Nancy. Now I understand what you're saying.
Yep.
Okay. All right. So we have summary, which needs a little work still. We have,
That first sentence should be modified then. A letter from go back where it's pinked. Yeah,
oh,
from the subcommittee is being drafted. That's being redundant. So
okay. Yeah, I thought that was talking about.
That's
let's
right.
see. So you're right. So
Take that out and leave your response in or vice versa.
how's that?
Yep, because that covers both of us. Yep.
Okay, then we have completed tasks. So first we have summary, completed tasks. This needs a little work in filtering this stuff out. So do people agree that we should say we should keep things in completed tasks that we've asked for, even though the task itself has not been completed necessarily? Or do we put that all into later section, uncompleted task, and then recommendations as well? What do we think about that?
God.
Yeah. Who was that, Nancy?
I forgot I wasn't mute.
Ah.
So can we just,
One half dozen of another, basically.
Completed the task of asking for it, so,
the ask has been made, but the task is not complete yet.
correct.
Okay, so we have the apple tree grant. Okay, so now let's put this here. Is that to figure out how to do this as a subcommittee? Okay, so then this will be then, I'm going to put a note here to include this in recommendations.
When you, I have a question.
Mhm.
It's in the pink highlighted area. ATSDR is going to set up caps to explore potential study options at some sites where we are involved. What does that mean?
Where they are involved, where ATSDR.
Okay, okay, all right. Okay, thanks.
So to, I think this goes in the recommendations section. Do you agree? We need to cover it in the recommendations then.
Yes, I think so.
Okay. Okay, so similarly, Gary, do you want to, can you write up a tiny little paragraph, or have you all already done so, about the Medical Society resolution adoption?
Yeah, I think I saw, I mean, the two AMA.
Yes.
Yeah, I can put a little blurb together. I'll send it off to you.
Okay. Just really short, just, and we can even put copies of them in the appendix. See. I'm going to ignore my typos right now, so they drive me nuts, but bear with me, guys. I just want to get this done as fast as possible.
You're kidding? I was gonna say a word.
ATSDR has had contact with New Hampshire Med in the past and has attended several of their events. We can work with NH Apple Tree. Is this true? Is that part of the Apple Tree grant, Katie? Is that one of the tasks outlined
Well,
in the
so
grant?
part of the Apple Tree grant is just community engagement and development of educational materials. And so we can explore, right? That can mean a lot of things or like a lot of different ways. So
Okay, so I'm going to put this in the recommendations also then, because
I wanted to bring that up under the CAP activities as well. And I can't go allocating resources on my own here, but I do think that asking ATSDR nationally to set up a CAP, it sounds like they're not planning to. I do think that the ATSDR grant, again, like I just said, has a community engagement component and perhaps could, you know, fill the void on a more local level. So I do think, you know, so exploring engagement with the ATSDR Apple Tree program, I think is a good recommendation. And if that makes sense. So I think in both places, sort of figuring out how to utilize this grant program to both engage community, sort of like a CAP, but also to develop educational materials.
Okay.
And again, I think this is really helpful from an agency perspective where we think about, you know, braiding the work of the commissions with already funded program work. It's really beneficial.
Yeah.
Can I just ask a clarifying question around how do we know, I mean, how did we hear that the ATSDR is not planning to start the CAP?
They sent it in an email.
Yeah, so we had communicated prior to my joining the commission. Karen and Mindy had drafted an email to Tara Summers at ATSDR, and she had responded back. And so sorry, I think that we missed, that was something that kind of got dropped amidst COVID. So we failed to provide that update at the last commission meeting, but we do have an email from Tara.
Do you want to just run through that email, Katie, just so that we all hear it then, so we all know what was said? Do you mind?
I just have to pull it up.
And you know what, actually, this is probably a good time to I just want to bring something else, and I don't know where it would go here, but that was one of the discussions that we had. It's come up a few times, just in terms of communication to the
Yes.
commission. Those, I mean, I suppose it's not a big deal, but I think that is one of the recommendations that we need to make for ourselves to further clarify maybe the sort of the access to information that would help. I think sometimes we don't know what we don't know because we don't have the information that's not necessarily getting to the commission. So, just I think that piece for us to discuss, maybe and clarify and make it easier for our DHHS and DES what we need from them, because that will, number one, it answers a lot of questions, but it also may help us to figure out where we need to be, what other goals we need to be setting, and maybe other policy or legislation or things that we need to be looking into.
Wasn't that listed in the legislation?
Yes, it is. That was one of the expectations and I think that's something we're sort of missing.
Yeah, I think it's important to think about, we have a place on the agenda to provide updates. And I think that's the place to bring sort of programmatic work that we can report out on. I think in this case, if COVID hadn't have happened, I think in this case, right, the health chair, subcommittee chair sent an email, and that would have been reported back on by the chair, because that was a correspondence between those two people versus the agency having an update on a project or a grant related.
Yeah, in this particular,
I think, right. So I think in this case, just to clarify, I think we just kind of lost the update due to COVID.
Yeah, it also brings up the broader need for communications to be received that have to do with, DES communications, MVD communications, anything that is part of the public record that we should be aware of. That's actually a big challenge of mine, having updates and not knowing. I mean, thankfully we have Merrimack reps in this commission and on the subcommittee that are aware of the current happenings, but it's difficult for outside of that for us to keep up to date on what's happening. So that's a good thing. So I've put in here, Nancy, if you didn't see it, reassert the need for commission. And I thought we should just input that language from the bill.
Yep.
Absolutely. Thank you.
Yeah, that's good.
Okay, so I think this so I just want to see, so we have a summary of what we've done. We have completed tasks. We have uncompleted tasks. We have recommendations, and we have legislative proposals. So if I missed any broad section here, or does anyone have we missed, we can go through these a little bit more in detail, but I just want to see, are we missing any structural elements of the report that we want to put in?
Well, in the summary, there's a list of participants of this subcommittee, correct?
There should be.
Okay.
There's a
List.
I'm going to go back to the structure of these reports and make sure those will be minor adjustments, but that's a good point. Usually you start out with that kind of stuff. Anything else? So we can, if I don't hear any other, we've gone through completed tasks. There's other things that should be in the completed tasks other than the AMA stuff that Gary's going to provide. We'll move on to uncompleted tasks. Again, just scan this, receive public consultation, coordinating with Merrimack hospitals. So what did that say? So this should go in the recommendations too. Okay, yeah, I did indicate that. This is covered in the later section. So unfortunately, Amy's not here. but I did draft a section called recommendations. So a couple of the pieces that we just talked about have to be inserted here, but this sort of gives a broad overview of some of the things that we Nancy, this is a concern of ours right here. I think it needs to be written up, specifically as a recommendation, because to make sure that it's captured somehow, somewhere.
Can I ask a question here? Is this, are you talking here about, okay, that was HB 511. The other,
Yes.
I was thinking too, HB 1538, the PFAS, my bill that actually was just recommended for not for future legislation, but to be basically absorbed
Yeah.
as a sort of a subcommittee of Senate Bill of 85. So I don't know if that's in there, but
I see the
1538.
bottom of your email. Yeah, so you said clarify communication expectations, which we just talked about, right?
Yep. Yes.
You said filing to add Londonderry.
Yep. I'll be doing that.
That's on the list here. Let me
Yeah,
see.
I saw that one. Yeah.
Okay, so that's covered. Discussion need for future development of PFAS provider education. That is not on here, and I will include that as a
That's
resubmission.
HB 1538, I think, right?
Yes. Yep.
Yep.
Just to make sure that we don't lose that piece, because that's really important.
I'll
And
have
that
to
was
get-
that 1538 was a commission. So, I think the work still needs to be done, whether it's by a commission or whomever, but that's the provider education is a huge
Mhm.
need.
Yeah, and until it actually is formally adopted somewhere, we should continue to recommend and push it. So
Yeah.
I'll just insert the title from the bill here.
Yep.
So this is, maybe it's best to go through this legislative proposals first. Oh, she did it. Okay, thank you so much, Katie.
I have it from your slides, so I just shared it. For
Oh, awesome.
Sure.
Thank you. Oh, I can't copy it out of there for some reason.
Oh,
Yeah, I can do it.
and everyone, I am going to have to drop off in just a minute or two for an 11 o'clock.
Okay.
But this is super productive. So thank you, Mindy.
I hope you're not groaning about this, guys, but this is really the most efficient way I can think about doing this.
And also, you guys have this until noon, just so you know.
Oh, good. Okay.
I'm very grateful that somebody with technology proficiency, because clearly you saw how long it took me to send you the.
I'll second that, Nancy.
Okay, so the proposals, let's do the legislative proposals first and see if Katie can do this before we get off then. So extend the statute of limitation from 3 to 6 years on chemical and PFAS related injuries. So this is just a list of legislation that we have all sort of talked about supporting next session, or ideas for us to give to somebody that could introduce them if they want to. So extending the statute, resubmission on HB 1569, which is Nancy Murphy's bill on fire suppressants registry. Resubmission of HB 1537, which is kind of like a housekeeping bill, just calling PFAS instead of perfluorochemicals, adding that extension of the larger group of PFAS chemicals. Resubmission of the PFAS education bill, which we just discussed. Legislation to update the cancer evaluation in 2018, including newer data and comparison with SEER cancer rates. We've talked about this a couple of times during the course of the subcommittee. Legislative proposal to create a chronic disease registry to collect information about the rates of certain outcomes, including but not limited to these things that we've discussed and kind of have now come to know are somewhat associated. Some of this is covered in the previous section, so we're kind of putting the cart before the horse here a little bit, but I think we all can agree, or at least some of us can agree, that these have been recognized or actually concerns brought to us by the public and commission members. and resubmission of 1274, which is the bottled water bill, which would compel bottled water companies to comply with our drinking water regulations, which they don't have to. Resubmission of HB 61 relative to medical monitoring claims, and proposal to add an elected and community member to this commission from Londonderry.
I have a quick question.
Absolutely.
Mindy, I'm also on the policy.
Mhm.
And that last one, proposal to add members, is something that we're going to be making a recommendation of as well. Now, again, you seem to know the ins and outs of this. Should that be stated in both policy recommendations? I mean, both groups, subcommittee groups?
Yeah,
Like we do it in the policy, it's basically a reiteration of that.
right. And, you know, however the commission chair wishes to finalize that report, but I think it's our job to summarize what we think is necessary. And so if there's anything missed in that policy group, these are our suggestions for what we think is important. And
So
they
the
can,
final report may say this recommendation was made by several committees.
it could, or however the chair wishes to have that, you know, that she could do that, or she could just have it as a general legislative proposal from, you know, I don't know how she's going to want to do that, but I think it's important for us to list all the things that we think are important to be at least presented to the full commission.
And I have two other bills. I don't know if they're going to be resubmitted this year or in the second year, but one is to remove PFAS containing food containers from public schools. And that actually got agreement and it was going to go forward, and then COVID happened. And the second one is to have well testing results for rental properties. And that looked like it was going forward also, and then COVID happened. So I don't know if those want to be included or not.
Thank you, Katie.
Sorry to interrupt. I just have to run. Thanks,
okay.
everyone.
I kind of feel like those are, while they're important, they're not necessarily related to Merrimack, but they are related for everyone. So I don't know. I'm open to whatever everyone thinks about that.
Yeah, I mean, it's not specific to Merrimack. It's specific to the entire state. And I guess Nancy is going to be holding a PFAS meeting so that we can all go over these. I don't think, well, I don't know. I don't know if they're going to be resubmitted this year or not. I'm open to resubmitting them the second year, but it's just something to keep an eye on.
Okay.
We do have rental properties in Merrimack. We have a lot of wells. That certainly could be an issue, but
What is the,
I could go either way. I'm sorry.
that one seems to be more relevant to this commission. Do we want to add that?
I think it makes sense to add that one. Yeah,
Okay.
the rental properties, because we do have people renting condos and things, and some in the close proximity. So I think it makes sense. And I think what Wendy was talking about was we are having a policy sort of a meeting to discuss different bills that we might decide to prioritize and put in. So I think both are certainly worthy, but I think certainly the rental one relates more specifically to this because, you know, our community is impacted, any of those people who rent in and around. And there are a lot of rental properties close to the site.
Wendy,
Yeah,
do you have a title or
I'd have to look it up. I don't.
anything? Yeah, can you just shoot me over so I can insert that with the rental
Water
probably? Yeah.
And the other thing, if we're talking about suggestions of future legislation, we need to figure out how to legislate, how to regulate disposal of all of these filtration cartridges that are being used in Merrimack. Right now, people are just throwing them into the transfer station, and that's creating another whole problem. So I don't know that anything exists right now. You know, I've talked to Chris Pappas and Jean Shaheen, and have proposed that we really need something on a national level to identify these as biohazardous.
The problem is there's no technology.
I know, well.
So it's kind of like, that's a huge issue. I agree. Same thing for wastewater solids and waste, biosolids.
Yeah.
Huge
Yep.
issue. There is no available technology right now. So it kind of goes to the licensing requirements of the facilities that
Yep.
accept them, that need to, and that's a whole other issue. Are they hazardous or not hazardous? And there's not an EPA that's going to rule in our favor on the fact that they should be considered hazardous waste and be in lined landfills. So it's a huge national issue. So I agree.
I just think we need something that says we're aware of the problem and we're keeping an eye on it. I don't have a solution right now because
Actually, that belongs in the environmental subcommittee. Can you contact, what's his name? I'm sorry.
Chris Daisy. Yeah.
I'm sorry, I lost his name. That actually should go under Chris's, our environmental subcommittee report, I think. I know it's a health issue, but it's more an environmental issue right now because they need to deal with those issues around it. So then the recommendation section, there was a reference to a bill which I couldn't find, which was a Tom Sherman bill. I don't know if it ever passed or what the deal was. I was hoping Amy could provide it, but I couldn't find it. Does anyone know about that bill? Something about, I'm not even sure what it was, how it relates to this issue, but anyway. So just covered, in the recommendations, I just said we're aware there are other commissions going on that have crossover in our arena, but I just said that. So, but the job of our subcommittee is to look at the issues at hand and recommend things. So I just provided a summary about the C8 science panel. Not sure now that this belongs in the recommendation section, but it does in a way because I lay out, there was some question as to whether or not there are outcomes recognized with respect to exposure, and it sort of builds the foundation for the health, for some of the recommendations that we're making, which is to create a registry of chronic health issues, which is something that's consistently been brought up by the public. So what I did was I said that, these are the recognized outcomes through the C8 science panel. Surprisingly, when I look at the ATSDR site, there were some holes in, I thought, unless I missed them. Let me just a second. Like they don't list ulcerative colitis, which has definitely been tied to thyroid disease. So there were some holes. So I thought it was good to recognize both of these studies and their conclusions to make the framework for what we are asking for the outcome registry. So I said outcomes recognized by both cancer incidences in the Merrimack area of all sites, endocrine disorders in the Merrimack area, and special education rates in Merrimack. So we were recommending that a registry be created, and if necessary, should that be a legislative proposal? I can't remember if I did that.
I think we
Yeah, I did.
changed special education rates to learning disability diagnoses. Remember we talked about that?
Which one's the broader category? Because here we don't want to say exactly what we want them to do. We just want to raise it as a concern that needs to be looked at by people who are in a position to fully understand that professionally. So I'm not sure if special education is a better term or if learning disabilities.
Well, but one was looking at the cost for special education, which are the rate. Oh, that's what I thought you were talking about when you said rates. Maybe you're not talking about rates. You're talking about numbers.
Talking about numbers, a registry.
But I mean, special education also includes 504s and.
Yeah, exactly. So all that's covered under the special education umbrella is what I thought.
But what I'm saying is I'm not sure that would give us valid information because it would include other things that may not be PFAS related.
That's part of the, I mean, what we're trying to do here is broaden. So these are recognized outcomes, not even by both studies, but we're trying to say maybe there's stuff that is going on we don't know about. So we want to have as broad an umbrella as we can have and say, does this mean something? And we are not in a position to dictate the connections between PFAS exposure and anything. So
Right, but
leaving
the
that
other
up to
thing-
you.
The other thing to remember is that Merrimack is known for its special education programs. So we have a lot of families that move to Merrimack specifically for special ed. So we may have an inflated number.
Do you
Because
see this? Do you see this right here though?
but that wouldn't affect families that move in and raise-
Ultimately, this information should be tied to the length of exposure and the concentration levels of exposure.
Okay.
That's
All
what it
right.
says.
So, yeah,
Yeah, I see what you're trying to do. I just think that there's, but I mean, I guess those can be teased out, I mean,
It's not up to us to do it. That's the thing.
yeah. I'm not objecting that there may be an impact to special ed. I'm just saying that there might be compounding conditions or something. like
Wendy,
that.
I totally agree with you, but I guess that's one of the variables that will have to be identified.
Yeah.
But I totally agree with you that has to be identified and included in the analysis.
Right. I mean, I think that it should be included. And I think if in the end it's decided it's not connected, that's fine, but at least it should be looked at.
I
Yeah,
guess
it's a data point.
Go ahead. Nancy, go ahead.
oh, you should think, I get Wendy's point. I mean, I think what she's thinking about is we can't assume that all of the special ed rates are related. And I think we all know that. And I think what she's trying to figure out is how to sort of identify which things are impacting. But I think that's that little sentence that afterwards will weed out a lot of the, anybody that moved here. I'm, as a parent of kids that have received special ed services, I'm not sure that years ago people used to move here. I'm not sure that's the case anymore, but I don't even think that matters, because when you look at length of exposure and level of exposure, that will sort of clarify the issues. And then when, special education, we're not going to be looking at, maybe, a physical handicap or a genetic thing, maybe. That will be decided, I think, when we start looking at what's important in that register, what chronic health issues are possibly linked. So I think leaving it broad allows the people that are going to make that decision to determine what to look at. And I don't know, I think it's okay as it is, because I mean, it's just a recommendation, and I think it will be an important one, and I think it's going to be something that's going to show us some things down the road. What it's going to be, I'm not sure, but I think being general like that and specific to the concentration and length of exposure will sort of allow things to be weeded out according to really what may be related.
The only question I had, and I don't have a suggestion to make it better, is that special education rates. I think that limits you. I'd like to think of a word separate from rates, because that's really just numbers of a population. It doesn't imply.
Services? What about services? And I mean, they can take out things that, I mean, there's all kinds of services. There's PTOT, reading specialists and everything else, but.
So how about we broaden it to learning? Yeah, I kind of see what, so something saying
I want to keep it a little
impacts to
bit.
children. Impacts to children, I don't know. Childhood educational impacts or something.
We could say special education impacts on the Merrimack area, because that's pretty global.
Is that good?
Yeah.
Mhm.
I like
Good
that.
for me. Yeah.
Let me just make sure I said the same thing.
Good job, Nancy.
Well, it's just rates was very specific. and
Yeah,
Anybody wants-
I think about it differently than you guys, but
Yep.
that's important to know.
Well, and I thought rates referred to money, so,
See,
yeah, so I like
it
impacts.
should be part of
Yeah.
it, but
Yeah.
it doesn't you don't want to limit it either.
Yeah.
Right.
Thank you.
Perfect, good.
Anything else that we should cover in recommendations? Oh, those are a couple of pieces that we need to pull in. Maybe I should just go through and pull them in right now. I think it's going to take a little bit more work, but I've identified these and I can go back and make sure that these are all included as long as the pieces are identified. So
I just have a question. I know in terms of, we have and I don't know where it is, but there was possible legislation regarding DHHS, doing a, outcomes kind of, I don't remember, the chronic health impacts, I think, and outcomes. Where is it? Keep going down, Mindy, just a little. Let's see, was that the registry? Yeah, I know we've looked at that in terms of legislation, but even if it isn't legislated, isn't that an ask we should have? I would think that DHHS is the place where these outcomes would be measured, and without the data that they would be collecting. I think it should be both an ask and a legislative request.
that's why it's in both places.
Okay, all right. I just can't see it all at once. Thank you.
It's in here in recommendations, and it's also in here in
Perfect legislation.
And so if they say we're doing it, don't worry about it. That's fine. We don't have to, but I know it's going to need legislation because it's going to be cost.
Yeah.
So we'll just hit it in both places.
Okay. Yes. Thank you. That was good.
Any other pieces we may have missed or not included in this? What I didn't do is go back and look at the slides to see if we've missed something. Yeah.
Well, to give you full credit, Mindy, we used those slides in helping us focus for our report.
Okay.
Yeah.
So, wait a minute. I am on unmute. I don't know if it belongs in this report, but I know that for that bill on the PFAS in food containers in schools, we were waiting for the study out of Washington State. They were going to come up with a big study, and then of course they got slammed with COVID. So I don't even know the status of that, but I think that's something that we should keep on our radar. That there's a big PFAS study coming out of I think Seattle or Washington.
What's the study about?
It's just the impact of PFAS on the environment and on food products. And it's just sort of a global study. And we were waiting for it to get concrete scientific proof that food containers should be eliminated. But I don't know the status of that. It obviously hasn't been released. I don't know if it's been postponed or what.
All right. Last call. Any other additions to this?
I'm looking at the slide, the health subcommittee update.
Yep.
And I don't know if this is addressed or it needs to be addressed. We had talked a while ago about blood testing access for residents, and we at DHHS informed us that they had the instrument capacity to test 60 to 80 serum tests additionally per month, but they didn't have the staff. So I don't know if that's something that should be a recommendation in the future, should the staffing be available, whether or not, because I know that access to blood testing was a huge issue that we didn't have. And I know Senator Chanley is part of the PFAS omnibus bill, that the PFAS testing will be, insurance providers are going to be mandated to pay for that. But I don't know whether or not, so I don't know whether that's something that we should continue to make that recommendation, that DHHS expand the access to blood testing for residents, should the staffing resources be available.
So to
That
me,
was in
that
our-
kind of brings up two different recommendations. One
What?
is, one thing that's always bothered me about insurance coverage, while it's great to have insurance coverage for PFAS blood testing, it's the onus, the onus is on the person's health insurance and whether they have it or not.
Mhm.
The other problem is that there's no central clearinghouse for knowing people that have been exposed. And the bigger the database, the better you are likely to find out that there's issues or not issues. The people that have moved into the state from, North Carolina who have had, those will get all filled out, they'll get averaged out in a registry. But I do think there's a need for a central blood registry for PFAS, like your AFFF registry.
Yeah.
I don't know if that's something we want to recommend as a legislative proposal. That again will be need to be legislated because there'll be costs associated with it.
Yeah.
And then you bring up a good point in an earlier recommendation from the slides was Tom Sherman's bill to provide additional staffing to both of the agencies, but there was conversation that that was not going to happen this session because it's a budget year. But we
we could still
probably
make
should
the-
put it in there. Yeah.
right. I
Does
think-
anyone have the bill number for that?
Which one?
His Senate bill for the staff recommendations?
I don't. I can look.
I tried to find it a little while ago and I couldn't find it.
I'll
but
try to look at it after this.
Do we agree that these two should be included as legislative recommendations?
I do. Yes.
Yes.
Okay, so we'll have to figure out some text for those. So Nancy, yeah, if you could just send me, so Representative Thomas, could you send me the rental, just the title? If it was in the bill number for the rental property one, I need the same for this Tom Sherman bill. And then I'll just write something about this so people know what it is. Any other recommendations or anything else that we may have forgotten to put in here?
We have in the slides again, we talked about determining necessary steps to assess exposure-related health issues. So we talked about serum testing, agency health survey, vaccine efficacy studies, and breastfeeding recommendations. And I know that was a huge issue.
Yes.
Because there was some concern that given what we were seeing with our lowered MCLs and everything, that what we know with breast milk.
How do we deal with that though?
In the data collection, when we're looking at I don't know, if we're looking at low birth weight babies, and we're looking at, I don't know. I mean, I think it's related to blood testing and it's related to
Does that go along with, should that be best placed in the physician?
education.
Yeah.
Well, it would be important. I know Katie was talking about the Apple Tree grant and education, what some of the things that they could address. And I think that might be a good place to address, because it sounded like it was community education rather than provider education, if I understood things. And I know the recommendation is breast is best, but I think that's one of those things that women should really understand, what the impact of PFAS on breast milk and certainly
That's
community
Apple Tree, okay.
education.
And I put the title of that bill and the bill number in the chat.
Got it. So that's actually going to be a recommendations then, right?
Yes, yeah.
Okay, let me put it in the recommendations section. This is legislative. I don't want to put it there. Okay. All right, I'll do something with that. And
Mindy, do we have HB 1456 in that health-related legislation? That was the DES to provide testing of PFAS levels to pregnant women and to provide pregnant women with elevated PFAS levels with drinking water that has low levels of PFAS in it.
you're talking about the bill last year?
It looks like, yeah, it was in 2020.
Yeah,
I
I don't
think that went through.
know it did not go through. I know it did
Yeah.
not. And I
Yeah.
think there are other factors that were written into that bill that made it unpalatable.
Yeah.
So I'm a little bit concerned about
Yeah.
suggesting that we recommendation right now.
Yeah.
In this session. I do think it should be an educational aspect,
Yeah.
maybe covered by the Apple Tree Grant, but
Yeah.
in terms of legislation, I
Okay.
don't know that I feel comfortable unless Gary knows a lot about this, I'm sure. Because he's in that committee.
We discussed that at some length, and one of the drawbacks was the transition of people in and out of the database. And not that you can't account for that, but the time frame for which people would enter that database would alter, your recommendation. I can't remember the rest of the discussion.
Yeah, that was fine. I just went through the slides and I just wanted to make sure that we addressed everything in it. So that was in it, but I think we got the rest.
Okay, great. So I feel good about the fact that we have a pretty decent working draft. There's a couple of pieces that I need. For some reason, I can't copy out of this chat window. So could you, Representative Thomas, send that to me via email? That'd be a lot easier. I don't know why I can't pick it off this chat. But if the members of the subcommittee are happy with this and, knowing that we'll have to do a little bit of work here, but I don't want to keep everybody on the line for that. Would like to open it up to see if Alan has anybody waiting to make public comment on this. We do want to hear if we've missed something that are concerns of the public. So if everybody's ready to do that, we'll move on to the public comment section, and if we'll address those concerns as we hear them.
That's good.
So if anybody in the public that's attending this, I can't even see if there are people with us, but if there is anyone that would like to comment on this, hopefully the Senate staff can let us know about that. Wait a couple more minutes here. I hear crickets from somewhere. All right, Alan, so seeing none, or Ava?
Hi, Mindy. So yeah, I don't see any hands raised as
Great.
attendees or anyone from the public, so we should be all set.
Yeah,
Great.
nobody.
Okay, thank you so much. So I guess I would take a motion to adjourn with the understanding that a little bit of work will be done in the meantime. I just as an order, I just feel that if we're working on some of these pieces, just please try to keep the numbers of people that communicate on those threads on email to a minimum, because I do think that is a concern when we involve more than a quorum of people on communications. But just out of Nancy Harrington, do you have something to say?
Yes, I would just like to request that a copy of the draft be sent out. I know that I like to be able to look at a hard copy, and if I see anything, I'll be able to communicate that to you.
Absolutely. So I will,
Thank you.
what's today? Tuesday. I will attempt to get a more final draft out to all the committee members, subcommittee members only before Thursday. So.
Even this rough draft is fine,
Oh, okay.
really.
Oh yeah, so then I'll just do this right now, if you don't mind that. And then If you have any additional thoughts, let me know after we adjourn. And I will do that. I will try to do it after we adjourn.
Thank you.
Because I can't do two things at once right now.
Done more than what I could do.
Anything else? Nancy, it looks like you might, Nancy Murphy, do you have anything?
Motion to adjourn.
Second.
Thank you. Thank you very much. And can I take the roll then? Representative Thomas,
Yes, indeed.
Representative Woods,
Yes.
Representative Murphy,
Yes.
Nancy Harrington,
Yes.
Katie Bush has left us, Amy Costello is not here, and Rebecca DeVries is not here. And I say yes, Mindy Mesmer.
Okay,
Motion
and
passes.
I sent you the information by email.
Thank you so much.
And thank you, Mindy, for your highly competent direction and coming up with this outline. I honestly believe we would not be where we are without your guidance.
Oh, thank you so much. That's
It
very
was,
sweet.
an amazing show of alacrity putting all that together. I'm just absolutely amazed. I'm watching
you.
this. I can't follow it.
For those of us who took 10 minutes to try to send an email, we're grateful. Thank you.
Thank you so much, guys. We'll
All right,
see you.
thanks.
So communicate via email between now and I think we need to get it Thursday morning, Ava said, to the larger policy or whoever it is. I can't remember now, but we'll do it.
Yeah.
And
Okay.
so communicate as soon as possible about any additional thoughts you may have. Thanks a lot.
Great. Thank
Have a great
you.
day.
Bye, everyone. Have a
Bye.
good day. Bye.